Now, according to the NCDC, there is a strong need to strengthen messaging around the ease of lockdown as risky behaviours are pressing a challenge. This is confronting the messaging on COVID-19 and its dangers. Well, for more on the impact of the virus in people, we have Dr. Safia Ojo, a family physician. She joins us from Abuja studios. I'd like to thank you, Dr. Ojo, for joining us at this time.
You're welcome.
All right, let's start with what we're seeing. Looking at the weekend and where we are in terms of our numbers, over 28,000. So we're getting more cases in Nigeria. How would you say we're doing in terms of the enlightenment and also reducing the transmission spread?
Thank you very much. COVID-19, we know, is a novel virus, which is a new virus, a new strain of the coronavirus, which has resulted in a very large death toll in some parts of the world. And we know the common symptoms of coronavirus, which include cough, chest pain, difficulty in breathing. Some could have other symptoms like loss of smell, anosmia, and some could also come down with some GIT symptoms. Yes, the war against COVID-19 is not a small one. We need to keep strengthening our health system and make sure we keep enlightening the public about the dangers, how this virus is being contracted, so that they can actually avoid coming in contact with the virus. So a lot has been said, but we need to still keep talking, especially in the rural area and in remote areas where there are no access to televisions, radio, to listen to what is about the virus, to know ways of preventing it and how to even present when there are symptoms, when to present to the hospital when there are symptoms of coronavirus. We know the impact of coronavirus is much. It has both physical impact on individuals and the nation at large, psychological impact and economic impact. We know how we are, most of our students now are at home because of COVID-19. Even a lot has happened because of COVID-19. Even economic impact it has really affected our economic impact. So I think we need to keep talking more about it, so a lot of people can get to know that there is existence of a particular virus and the risks of contracting it. Then one thing we need to also work on is we need to also, those that are high risk group, like the elderly people, those with diabetes, with chronic illnesses, diabetes, hypertension, heart diseases, asthmatic patients, all those conditions, they are prone to having severe forms of COVID-19. So we need to emphasize on that. We need to let them know that they must continue on their medication. Lifestyle, very important, like exercise, trying to eat a healthy diet, and try to avoid contact, limiting large crowds, and making sure that the social distancing is being adhered to, then washing of hands with water and soap, or the use of hand sanitizers. Indeed, so I think a lot has to be done. We need to keep talking about it, and like more talking about it will help a lot of people to know about it. So
Dr. Ojo, right, if I just quickly may, contact tracing is also a very important factor in this fight. And seeing that we're going to have travel opened July 8, talking about air travel, and then we have the interstate travel ban that has been lifted. How effective would you say our contact tracing is? We have several countries who have contact tracing apps that seem to be working. But, you know, for us, and especially in tracing and tracking the carriers of the virus, how effective would you say our contact tracing efforts are?
Well, contact tracing is very important. If you need to to limit the number of people coming down with COVID-19, doing contact tracing, yes, we need to know. People have to be screened to even know if they have the virus or not. And you need to also know who they have come in contact with, their family members, where they have gone to after that, so that a lot of people can be tested to know if they have contracted this COVID-19 or not. So the role of contact tracing cannot be overemphasized. It's very important. It's mandatory. So that's why, like in the case of Cross River now, they're talking about, this is something we need to really work on. The contact tracing is very important. And those that are even tested, let more people be tested, so that let there be facility to even test, to know who is positive and how do we even do contact tracing to know how to combat this, to reduce the incidence of new cases of COVID-19. Even talking about the flights, yes, we need to, life has to move on even if there is COVID-19, but a lot of measures has to be put in place. For example, the social distance, even when you want to board a flight, a plane, you need to, like, the social distancing measures has to be put in place. Hand washing and all that, temperature checks, appropriate check of the luggages and all that will also help to limit spread of COVID-19. So it's very important, it's paramount for us to do contact tracing so as to reduce the risks of those coming down even with severe forms of the disease.
We'd like to appreciate your time, Dr. Safia Adhere, family physician. Thank you for joining us on the program.
You're welcome.